Good day, guys. I am Chelsea Castro, and today we are here at CSA Medical Aesthetic Center. Back in 2019, I visited Doc, and then nagpa-refill ako ng nose fillers at saka nose threads. And also, I had my masseter Botox. And then, so syempre, it's been a while since I had my masseter's Botox ulit. So I feel like I am back to having a wide face. And syempre, yung goal natin is hugis bigas. So yun, I think concern ko ngayon is yung masseter ko nga. And then, I feel like dahil, kumbaga genetically, I really have parang chipmunk cheek. So, gusto ko medyo mag-slim down yon, more on a contoured side kind of face. And also, ma-lift up lang ng konti. So guys, abangan yung gagawin ni Doc Contessa. So don't forget to like, subscribe, and click on the notification bell to see more of Doc Contessa's videos.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll have another face contouring procedure. But before that, let's welcome back Chelsea Castro.
Hello po. Hello mga ka-CSA.
Okay, so Chelsea will be turning 25.
Yes.
Right? And she's in med school, 3rd year.
Apo.
Right. And baby face pa rin. Okay.
Sana.
Yan. So, well, actually I was assessing Chelsea a while ago. I was looking at her face, okay? The upper third of the face, so far so good yung tinatawag na sa forehead region, yung natural convexity. The brow area is very good. The upper eyelid is very good. But when we go to the mid-face section, I noticed lang beginning sunken under eye na. Ayan. Napupuyat from med school, okay? So, like in this age, there are concerns of under-eye volume loss or some of the starting skin laxity. Yan. Tapos, nagkakaroon na ng beginning lines under the eye region.
Bumababa na yung collagen.
Exactly. So, it's the collagen breakdown also. So, with Chelsea, actually, I wanted to do another treatment for that one. Aside from face contouring procedures, we'll be doing something to rejuvenate the under eye. Sabi kasi, aging starts at this, okay? It's not naman na, kasi the others are saying, oh, 25 years old ako, matanda na ako.
Yeah.
It's just that parang some signs of aging pwede nang maging visible. So if you're not doing anything to prevent it, ayan. So mabivisualize mo na yan as time passes by. Okay, so sa mid-face region pa rin tayo. I was telling Chelsea, if you do a profile view, medyo there's a beginning already na this one here, like a beginning pagsag na. Okay? Or like yung cheek niya, it's beginning to be flat na here. Kasi naturally, there should be this curve, OG curve, or the so-called convexity of the cheeks. So on a side view, there's already a beginning, na dyan eh. Ayan, pag flat na. So medyo nawawala na yung pagka-convex, nawawala na yung OG curve na tinatawag. Although when you smile, ayan, you can still see the roundedness of the cheek area. So we wanted to do lang something na it's not making the cheek become bigger or puffier, parang ganon. Or we're not gonna give you a blown cheek treatment. We wanted lang something to also do a cheek contour. Yeah, that's better. Yun yung mas magandang word.
Yeah.
Cheek contour lang. And then going below, so lower third of the face, this area here, yun, yung parang may, ano pa ba? Chubbiness?
Chubbiness.
Baby fats. So this part here, we wanted to do a treatment that somehow is gonna reduce this one, the bulge here. Minimal bulge here, okay? And when we go to the posterior part of this one, so dito na sa angle ng ating jaw, we wanted to also slim the masseter here. Yan. So, and then, under the chin, punta pala tayo dito. Yeah, I remember na kasi you were mentioning to me a while ago, you wanted to do a treatment also for this one, the submental part. So, we can do something to tighten it, firm it, so it will not sag.
Yeah. Kasi po, I lost weight back
Yeah,
in quarantine. So, parang nagbaba lahat. No?
Yun. Yeah pala, Chelsea
ko.
like did this weight loss program?
Yes po.
Yeah.
Yoga, ganyan. To keep myself active during lockdown.
Oh, yun. So after losing some weight, yung skin nagsasag.
Yes.
So we wanted to do a procedure na somehow will restore yung natural skin elasticity, tightness, firmness. So we'll be doing mga combination procedures today. Ano kaya ang ating mga products, materials, techniques ating abangan sa pagbabalik ng CSA Medical Aesthetics. We're back, mga ka-CSA. So we'll be doing a procedure for face contouring. Now, my work will be on the cheek region and on the lower face part, on the jawline region. I'll be using my PDO threads for Chelsea. Well, the PDO threads are already used for not only for rejuvenation, also for contouring. If you want to do a cheek contour, if you want to also do something to regenerate the tissues to prevent aging, so we use those PDO threads. Now, the material that I will be using, it's not the simple mono smooth thread, but we will be using the so-called screw PDO threads. And screw PDO threads, they have an advantage over the mono or simple or the smooth type of thread. When you have something like a spiral or like a tornado or like a screw thread there, it stimulates more fibroblasts to synthesize new collagen fibers or collagen tissues. So it has a more advantage in terms of firming and tightening as compared to the simple, straight or just a mono strand. Okay, it's a lot better. So it's a better PDO type of thread, the screw threads. Okay, so whenever we do that kind of procedure, we also do our surface land markings. Okay, this is anatomy, Chelsea. Okay, from the Aller group, you make a diagonal line above, going towards the zygoma. Okay, and then from the corner of the mouth, okay, going towards the tragus of our superior border of the tragus. So from the corner of the mouth to the superior border of the tragus, and then you can make your diagonal lines again like that. So for those who are beginners or novice to these kinds of procedures, so if you want to do some surface landmarks, you can follow this so that you have a guide. And then for the lower part of the face, we just do something like this. You can use 3 or 4 to 5 lines like that. So for those who wanted to do some markings, these are just basic lines. Then if we do our submental, what I do is like I make a horizontal line like this, and then I also make a diagonal line like that. Okay. Some of my patients, I still do a like a crisscross or like a tic-tac-toe. Ivana, you know that tic-tac-toe marking also. So I'll change my gloves again. Okay. So for the purpose of like having a sterile field, so you have to clean the area again. Make sure that it is, we have to avoid infections, okay? So clean the area, use your antiseptics. Okay, so we have to erase again our markings, okay? But for the beginners, you can make use of those markings, you can follow those, okay? Since we're doing this already for a long time, so I've been doing this PDO threads for a long period of time, so I already know where to insert my materials. So before we do this, of course, you have to give something to anesthetize the skin. We have to have our topical lidocaine. So we can use a screw thread that is 29 gauge 30 millimeter. So we're starting with our cheek area for our cheek contour. So I have here, it's gauge 29 with a 30 millimeter length of my needle. Okay, are you ready, Chelsea? Okay, this is just a simple technique. Okay, so you do this like that and then insert subdermally. Okay. So 1 cm apart only. So take note, this is a screw type of PDO thread. So others, when we share with them this kind of procedure, we just explain to them, it's just like doing some acupuncture-like technique. But the way you insert the needle is parallel to the skin. Because when they do the acupuncture, they do it perpendicularly. So it's just that. So I'm using like around 10 of my screw threads here. So just to give you that very good cheek contour, it's like having this curvilinear approach here. So now when you remove this, you have to somehow make a rotational movement there. Okay. So again, this is using PDO screw thread. Okay, so I'm gonna finish this side first. So I'll be using already for the lower part of the face. So for this one now, I'll be using my screw thread that's longer. So this is like a 29 gauge with a 60 millimeter length. So it's like doubling the length of the needle a while ago. So this is for the jawline region. Okay, I'll pinch the skin like that. So this is just the vector for this. So it's gauge 29. Okay, there you go. So it's longer. So this is to help Chelsea's skin also to further rejuvenate and to give that contoured effect. So again, this is a screw type of our PDO thread. So it's longer, but the gauge is just 29. And last one for that. So we're almost done with the right side. Okay, so again, when you remove it, twist a little bit. Twist a bit. Okay, are you good, Chelsea? So far so good. Okay, so I'm doing the right side. I want to finish the right side first. I can proceed to the so-called under eye Derma spring treatment. So I have another kind of PDO thread that is in an arrangement that the threads are like in a spring type or spring form. So it helps in improving the elasticity of the skin and further stimulates the collagen. So I'll be anesthetizing the corner of the eye. Okay, inferior-lateral. Okay, inferior-lateral to the lateral canthus. Okay, just a single point entry here because we'll be using a cannula for the under eye. So that the one that we will use, cannula for the under eye. So it's not the needle type. Okay, are you still good, Chelsea? Okay, so my puncture needle is gauge 23. Okay, and then I'm using now, this is a spring type of this is Derma spring. Gauge 29 with a 40 millimeter length of our needle. So we'll just thread this through this entry point here. So this is in a cannula type. Okay, and then just thread it. It's in a subdermal plane. Okay, there you go. And then second one, we'll use the same entry point. So the goal here is to leave the thread in the subdermis region. And a third one. So 3 Derma spring will be enough here. Okay. And last one. So again, this is a cannula. The cannula is loaded with those screw or rather spring type of PDO threads. So we're done with the right side. Okay. Yeah, using those types of threads. Okay. Actually, the masseter, as I mentioned, I'll be doing the injection of our botulinum toxin to relax this chewing muscle. So I need you to bite, Chelsea. So it's very strong, and actually I felt the intensity. So for women, they wanted to have a slimmer face. You can do your masseter injection with botulinum toxin. There you go. So later on, actually, I will still be doing the injection of a meso fat dissolving solution into the deep middle cheek fat pad, okay, as well as the buccal fat pad to further slim your face. So we'll do that as a last procedure. Okay, so let's proceed to the left side. So clean the area again, disinfect. So again, I've mentioned a while ago, we already applied topical numbing cream. We left it for about an hour, right? Yeah, the longer you leave it, the better. So I'm starting again with this one, screw thread, PDO screw thread, which is gauge 29 with 30mm length of our needle. Okay, so same technique as the other side. Okay, 1 cm apart, okay? So for our viewers, we recommend that you only go to your certified aesthetic doctor to do procedures like this. Of course, we know what's the reason behind. And you have to be very knowledgeable with the face anatomy. Right, Chelsea? Doctora? Or soon-to-be doctor? So, a few years from now, we have Doctora Chelsea to be with us also. Okay, so we're done with the 10 screw threads, and then twist and pull out, twist, pull out. So the reason why we just wanted to leave them is for hemostasis also, Chelsea, okay? And then I'll proceed with the gauge 29 screw thread that is longer, 60mm for our jawline here. Okay, again, inserting, and this is our vector. It's like a lateral vector, so 1 cm apart. So we have a long one here, and it's in a parallel insertion, parallel to the skin. And last two. Okay, seems like a simple technique, but of course training is required, and we just wanted to have a well-contoured face and a tight and firm skin, because Chelsea had some weight loss, so she wanted to prevent the sagginess of the skin. Ayan. So para V-contour din, no? Okay. So right now, I'll proceed to the under eye left side. So again, this is my lidocaine for my entry point. So I'll be using a gauge 21 needle. Okay. So gauge 21 needle for the under eye. In the past, we were using the other type of our thread, which was the Super Tornado under eye. But for cases of like just a mild problem like Chelsea, you can use this Derma Spring under eye. Actually, even for those with eye bag concerns, you can also use this one. But we also combined with scaffold thread. So maybe next time we present to you scaffold thread for under eye. So same entry point only. And last one. Yay! And then, so we'll proceed with the Botox, rather the injection of botulinum toxin on our left masseter. Bite, please. Ayun. I felt the strength of the muscle here. So just a 3-point injection for this part here. Take note for those people having their masseter injected, make sure that it's in the right anatomical injection point, because the anterior border of the masseter has this connection with the rhizorius, which is part of the smiling muscle. So for people that they have a concern, there's an unequal or uneven or asymmetric smile, so the rhizorius could have been like injected with the toxin, or some of the toxin diffused into the rhizorius muscle. So we're done with the major procedures. The last part will be the submental area. So with this one, I can still use my screw threads there, okay? Or you can still also use your mono threads or simple threads, okay? We're going to treat the submental area. We wanted to tighten the skin there. So we'll be using also the screw thread here, 29 gauge thread. Okay, so you can make like a diagonal approach there. So actually, one time in my lecture, they were asking me, is it really important to follow those lines, those guides, those markings? So actually, it's ideal to have those patterns because, you know, when skin tissue structures are developing, it's better also they have this systematic pattern, so that when they synthesize new fibers there, it's neat, it is smooth, and there will be no irregularities also. So we just wanted something that's neat looking, smooth, and of course better formation of those new collagen fibers, right, Dr. Chelsea? So it's ideal to also have your patterns be followed, so like a 1 cm apart, and directions will be like what vector are you going to use. That is also very important, okay? So as an aesthetic physician, so it's very important to take note of that, okay? Yay! So I'm doing like the vector is towards that. Okay. What do you mean by vector? So it's actually the direction of your pull or the direction of your threads. Okay, so again, this is a screw thread, so rotational maneuver there. And then finally, I'll just be doing like a horizontal line there. Okay. So this is my last 4 screw threads here. So actually, I can do like a technique also here that I'll insert in between. Okay, again, so there is this system here that you can follow. Okay, last one. So we use a total of 10 screw threads for this part here. So again, subdermal plane is your anatomical plane of insertion. Okay, so we have done multiple injections for Chelsea. Yeah, so we'll be showing the result to Chelsea when CSA Medical Aesthetics return. And we're back, so we'll now show the result to Chelsea. Of course, we did injections and you'll expect some injection marks. So Chelsea, here's our mirror, just for you to see what happened. Okay, so we have some transient or temporary erythema, those injection marks over the lower part of the cheek, and also here on the marionette line, and then also the lateral aspect of the, or inferior to your lateral canthus, there's a blotch there because of the topical, the injectable lidocaine. Okay, so the goal here again is to give that contoured shape face, especially for Chelsea. Of course, we were mentioning a while ago, so some of still the like a cheek fat pad are still prominent there. So we just wanted to give it a better curve of the face, a better contour of the face, and we wanted to really highlight the features, particularly like the jawline area. So we also combined our injection of the masseter with our botulinum toxin. And then the under eye region, again, I've inserted Derma spring eye threads, PDO spring type of threads, to restore the skin's elasticity. They're actually the thinnest part ng skin all over our face, the under eye region. So we wanted to kind of restore the volume there, at the same time stimulate collagen formation there. So Chelsea, how was the experience?
It's okay, it's painless. I mean, I think if I'm going to rate it from 1 to 10, mga nasa 1 lang. Parang kagat langgam. So
Yeah.
for everyone who's having those inhibitions na baka masakit, it's not. It's very tolerable. You have topical and injectable anesthetic to begin with naman eh.
Yeah.
So yun.
Right.
And kung gusto niyo ng
Nag-source ng threads.
threads, sabi niyo lang po din. Hindi ko pong muwaka ako na din.
Yeah, just to add also, those types of threads actually may mga classification. We have different kinds of protein fiber threads that we use for face rejuvenation, face contouring. or regeneration of the tissues of the face, no? So this one that we use right now, these are PDO type. Okay, these are absorbable suture threads. Because in the past, they were using non-absorbable types, but then because of those like a permanent type of a thread, they were saying that there are some like problems like several years after doing those thread insertions. So they converted the threads to those absorbable na. And they found out with the absorbable type of threads, they induce skin regeneration also. Kaya pala yung pag na-absorb na yung thread over time, because it induces neocollagenesis, it still has that effect. So parang we say it's like a semi-permanent type of an effect. So it induces or stimulates your fibroblast cells to synthesize new collagen elastin fibers. So it's improving the skin tissue matrix. So from non-absorbable, right now we are all using absorbable type of our suture or regenerative type of threads or revitalizing type of threads. Now with those absorbable types, meron pang classification. Okay, because we use the PDO, there are the others PCL, PLLA, or a combination of the PLA caprolactone. So may combination, and I think they're making another type of threads na naman, the absorbable types of suture threads. But the goal again is to restore the skin's elasticity, restore volume, rejuvenate, induce lifting, tightening, firming.
Collagen formation.
Yes. Collagen formation.
Doc, I have a question
Yes.
po. So, can I pinch my cheeks?
Okay, it's okay lang if like you touch it, you pinch it, or somebody just like accidentally hit your face. No problem. Don't worry. Because this will naturally bind. They're like protein strands. They're like filaments that will really blend in or integrate with the tissues of the face. That's a very good question. First time ko naka-receive ng question ng ganyan. Anything anymore?
No,
Anything
okay na.
Okay na.
Yes,
Wala
po.
na. Oh, that's it. So, okay. So, actually, we're adding inputs on those types of suture threads. Probably in the future episodes, we'll further discuss ano pa yung mga further advantages nito. What else can we do with it? Because we also do it for the neck. Also for the hand. Diba? For the arms, for the tummy region, body region. Meron ding mga threads for that. So, in the future episodes, we can further discuss all of those new informations. And by the way, later on, we'll still do yung meso fat dissolve injections. And actually with that one, you'll see result after 2 weeks, usually sa mga mesotherapy, fat dissolve injections. So, aabangan pa natin yung mga results mo. Before and after photos we'll be showing to our televiewers. Okay, thank you so much, Chelsea.
Thank you. Thank you mga ka-CSA for watching and supporting my doctor here, Dr. Contessa.
Yeah, by the way pala, if they have, like they wanna ask you about your experience, yung result, can
Yes.
they reach you also?
You can search me sa Instagram, Made in Chelsea. Dito ba?
Made in Chelsea.
Dito, yan.
Yeah.
So,
Ayun.
yun. Thank you so much for supporting us.
Okay, so if you have any other questions, you may email us at csaskinclinic@yahoo.com, our Instagram, CSA Medical Aesthetics, FB page, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Our contact number 0933-860-9193 or 0917-504-4268. And our other episodes are in the YouTube channel, only type Contessa Salvador. So, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.